Hey everyone, welcome back to Brain Beams. Today, we're talking about something that's often misunderstood, the vagina. For years, it's been whispered about, shrouded in secrecy, and subject to a lot of misinformation. Whether you're curious, misinformed, or just want to learn, this video will break down everything you need to know. Facts, myths, and essential health tips. So let's dive in, ditch the embarrassment, and have an open and honest conversation about the vagina. Alright, let's start with the basics, the anatomy. Many people confuse the vagina with the vulva. The vagina is internal, a muscular canal that leads from the uterus to the outside of the body. The vulva is everything you see on the outside. It includes the labia majora, labia minora, clitoris, and the vaginal opening. The vagina is an amazing organ. It's the passageway for menstrual fluid, expands for childbirth, and receives the penis during intercourse. The walls of the vagina are incredibly elastic, stretching and returning to their original shape. This elasticity allows the vagina to accommodate both a tiny tampon and a full-term baby. The vagina is also home to a delicate balance of bacteria, known as the vaginal flora. These bacteria play a crucial role in maintaining a healthy vaginal environment and protecting against infection. Now that we've got the basics down, let's move on to debunking some common myths. Let's be honest, there are a lot of myths and misconceptions surrounding the vagina. These myths can lead to shame, embarrassment, and even harmful practices. One of the biggest myths is that you need special soaps, douches, or washes to clean your vagina. This is absolutely false. Using these products can actually do more harm than good. The vagina is a self-cleaning organ. Using harsh soaps or douches can disrupt the delicate balance of bacteria, leading to infections. Plain water is all you need to keep things clean down there. Another common myth is that a tight vagina means someone is a virgin. This is completely untrue and perpetuates harmful stereotypes. The vagina is an elastic muscle that expands and contracts. Factors like genetics, age, and childbirth can influence vaginal tightness, but it's not an indicator of sexual history. Let's stop spreading this harmful myth and focus on respecting each other's bodies and choices. Let's address the stigma surrounding menstruation. Period blood is just a natural bodily function, a sign of a healthy reproductive system. It's not dirty or something to be ashamed of. Let's normalize periods, have open conversations about them, and support each other throughout our cycles. Another misconception is that all vaginal discharge is abnormal. Some discharge is completely normal and healthy. The vagina naturally produces discharge to keep itself clean and lubricated. Normal discharge can vary in color, consistency, and amount depending on your menstrual cycle. However, if you notice a significant change, consult with your doctor. Vaginal dryness can be caused by various factors, including stress, medications, and hormonal changes. If you're experiencing vaginal dryness, talk to your doctor. There are treatments available. Now that we've debunked some common myths, let's talk about how to take care of your vaginal health. Knowledge is power, and when it comes to our bodies, knowledge is essential. Practice good hygiene, but remember, good hygiene doesn't mean douching or using harsh soaps. Wash the external area, the vulva, with mild, unscented soap and water. Avoid scented feminine products. They can irritate the delicate skin and disrupt the natural pH balance. Choose breathable fabrics like cotton for underwear. Cotton allows air to circulate, keeping the vaginal area dry and preventing the growth of bacteria and yeast. Avoid tight-fitting clothing and synthetic fabrics. Staying hydrated is crucial for overall health, including vaginal health. Drinking plenty of water helps to flush out toxins and keeps the mucous membranes in the vagina healthy and lubricated. A balanced diet, rich in fruits, vegetables, and whole grains, can boost your immune system and promote overall well-being. Practicing safe sex is essential for preventing sexually transmitted infections. Use condoms consistently and correctly, and get tested regularly for STIs. Wipe from front to back after using the toilet to prevent bacteria from entering the vagina. Regular checkups with your gynecologist are important. your gynecologist can answer your questions, address concerns, and perform routine screenings. They are your partner in vaginal health. Our bodies are amazing and have a way of telling us when something's not quite right. When it comes to vaginal health, it's important to listen to those signals and seek medical attention when needed. Unusual discharge is a big sign. If you notice a change in the color, consistency, or odor of your discharge, or if it's accompanied by itching, burning, or irritation, get checked out. Pain during sex, urination, or persistent pelvic pain should never be ignored. It could be a sign of an infection, a hormonal imbalance, or another underlying condition. Any unusual bleeding should always be checked out by a doctor. Bleeding after sex, between periods, or unusually heavy periods can all be signs of something more serious. Itching and irritation in the vaginal area are never normal. If you're experiencing persistent itching, especially with redness, swelling, or a rash, it could be a sign of an infection. If you notice any unusual sores, lumps, or bumps in the vaginal area, see your doctor as soon as possible. Many of these may be benign, but it's always best to err on the side of caution. Early detection and treatment are key to preventing serious health issues. Listen to your body, pay attention to any changes, and don't hesitate to reach out to your healthcare provider. So there you have it, a crash course in all things vagina. We've talked about anatomy, busted myths, and empowered you with the knowledge you need to take care of your vaginal health. Remember, your vaginal health is an important part of your overall health and well-being. Don't be afraid to talk about it, ask questions, and advocate for yourself. If you found this helpful, don't forget to like, share, and subscribe to Brain Beams for more informative content.